Today we are covering hypertension, a topic that is guaranteed to show up on your NCLEX exam. The test won't just ask you to define it. It will require you to apply your knowledge in clinical scenarios. Let's start with the numbers. Normal blood pressure is less than 120/80. Elevated is 120 to 129 over less than 80. Stage 1 hypertension is 130 to 139 systolic or 80 to 89 diastolic. Stage 2 is 140 or higher systolic, or 90 or higher diastolic. An NCLEX question might give you a patient with a consistent reading of 136/84 and ask for the priority nursing action. The answer isn't medication. For stage 1, the first-line intervention is always patient education on lifestyle modifications. This is a common exam trap that tests your understanding of stepwise management. Uncontrolled hypertension silently damages target organs. The exam will test your ability to connect the disease to its consequences. For the heart, think myocardial infarction and heart failure. For the brain, think stroke. For the kidneys, think chronic kidney disease, so you must monitor BUN, creatinine, and urine output. For the eyes, think retinopathy, which a patient might report as blurred vision. Expect a question where a patient with a long history of hypertension now presents with new onset confusion or decreased urine output, and you must identify this as target organ damage. Pharmacological management is a major focus. For ACE inhibitors, which end in pril, like lisinopril, you must know the key side effects. A great mnemonic is ACE itself. A for angioedema, which is life-threatening swelling of the face and airways. C for a persistent dry cough. And E for elevated potassium or hyperkalemia. The NCLEX loves select all that apply questions on these side effects. For beta blockers ending in -ol, like metoprolol, the rule is to always check the patient's heart rate and blood pressure before administration. Hold the medication if the heart rate is below 60 or if the patient is hypotensive. A critical exam point is that beta blockers can mask the symptoms of hypoglycemia in diabetic patients, so they won't get the typical shakiness or tachycardia as a warning sign. You must be able to distinguish between a hypertensive urgency and a hypertensive emergency. Both involve a blood pressure greater than 180/120. The key difference, and what the exam will test, is the presence of acute target organ damage. If a patient has a blood pressure of 190/122 but is asymptomatic, it's a hypertensive urgency managed with oral medications. But if that same patient has chest pain, slurred speech, or changes in vision, it is a hypertensive emergency requiring immediate admission to the ICU for IV medication to lower the blood pressure in a controlled manner. Patient education is the foundation of long-term management. The NCLEX will test your ability to provide practical advice. This includes teaching about the DASH diet, which stands for Dietary Approaches to Stop Hypertension, emphasizing fruits, vegetables, and low-fat dairy while reducing sodium intake to less than 2,300 milligrams per day. Other essential topics include the importance of regular exercise, weight loss, limiting alcohol consumption, and smoking cessation. These lifestyle changes are not just suggestions, they are primary nursing interventions.